Arthroscopic T-capsulotomy with capsule traction and double pulley circumferential reinforcement for femoral acetabular impingement, a biomechanically optimized closure technique. These are our closures with regard to conflict of interest. The T-capsulotomy is one of the most common techniques in hip arthroscopy for FAI. However, T-capsulotomy often presents a technical challenge during suture closure. The central crossover region of the T-capsulotomy resulting in inevitable capsule deficiency potentially compromise the iliofemoral ligament integrity. We now present a technique to address this limitation. This is a patient with right hip FAI. As you can see, after anesthesia, the patient is placed supine on the traction table. Usually, we establish the 3 standard arthroscopic portals, the AL portal, the MA portal, and the DALA portal. Typically, the T-capsulotomy is performed along the longitudinal axis of the femoral neck, through the mid portion of the interportal capsulotomy. After T-capsulotomy, we place traction suture on the lateral capsule flap. Elevate the capsule flap gives us much better exposure of peripheral compartment. We now use the same method, placing traction suture on the medial capsule flap to improve arthroscopic visualization. Following completion of peripheral compartment procedures, the 2 traction sutures were retained. The medial ends of both traction sutures were shuttled through the corresponding medial capsule tissue using a suture passing device. The 2 ends were retrieved with a grasper and tied extracorporeally with a no-sliding knot. The lateral ends of the 2 traction sutures were then pulled to advance the knot back to the capsule surface. The lateral ends of 2 traction sutures were retrieved through the same portal using a grasper and tied with a no-sliding knot. We have now completed circumferential reinforcement suture of the T-capsulotomy. Schematic diagrams can help simplify the understanding of this technique's procedure steps. Thanks for your attention.